Uh, Kate Haldeman is from Citizen Health, and I talked about Citizen earlier today in my presentation, but they allow for an alternative access point to natural history data by using medical records along with other data, and they have some new exciting features for patients to use to empower their own daily life as well. So I'm sure Kate will take us all through that. So take it away.
Wonderful. Eric, thanks so much for the intro. It is a real, true privilege to be here today to meet with the community. I'm excited to share more about Citizen Health and how you can get involved. And if you're already involved, how you can continue to enhance your experience and some of the new features we have available for you today. So again, as Eric mentioned, my name is Kate Haldeman. I support our community partnerships at Citizen Health. And really what we are all about is empowering patients, advocates, researchers, really the entire rare disease community with real world insights from patient consented data. As you all well know, data is key to unlocking critical insights and support we need, not just for research, but to make better decisions in our, day-to-day about the next steps for our care journey. So I'm going to talk a little bit about the model that we use to make it as easy as possible, as fast as possible, and as affordable as possible for patient communities. First, a little bit about us. So we are a team of patients, of caregivers, of advocates ourselves. Pictured here is Amara. Amara is the daughter of our co-founder, Nasha. Amara has a rare neurological condition called FOXG1 syndrome. She has 50 seizures a week, frequent hospital stays, requires 24/7 care. This is not unfamiliar to all of you. The reason I bring this up is because, this is core to our mission, which is we are acutely aware that the current medical system is not fit for rare disease community members. The care that Amara needs is not the care that, the system is built to support in terms of like the average patient, nor is the way the drug development process right now works really well suited for rare disease. That's, quite evident by the fact that we have over 10,000 rare diseases and 95% don't have a treatment. It takes too long and it's too expensive to develop the drugs and treatments that we so desperately need. Core to what we believe here at Citizen and why we are partnered with, 75 plus rare disease communities, it's because the key to moving the needle on much of this is helping to gather robust patient data, right? The more data we have on the communities, the better we can shed a light on the condition, we can de-risk it for research, and we can accelerate research. To date, the typical way that we have done things in the rare disease community is the all-important natural history study. I know this is something that the Kleefstra syndrome community is undertaking right now. It's a wonderful effort to really capture the baseline of the condition. How does it progress? Make sure we can characterize the full spectrum of the disorder. This is incredibly important in the grand scheme of drug development. Um, it's really important to establish the disease baseline because this helps researchers have a jumping off point to answer the important questions that they have, to help even think about better and more efficient clinical trial design, and from a patient community perspective, to help guide better patient care decisions. Some things that we do notice with natural history studies is that maybe not every patient can support physically. We can't all get to the sites. We might be missing some of the data. It's a very expensive endeavor to take on. So at Citizen, we've been thinking about what are opportunities for us to help complement these very important efforts, so we can make the creation of the knowledge base that we need even faster and more efficient. So then the question comes, where else can we get this data that we need? Well, the truth is that each patient's medical journey is essentially a natural history study waiting to be unlocked from the medical record, right? Rare disease patients interact with the health system constantly. We leave a breadcrumb trail of data wherever we go, but to date, that really has not been accessible. There's no one longitudinal view of your medical history, right? It's trapped between genetic test results and EMRs and various places that you have received care. And here really lies the powerful solution in Citizen Health. We are able to, with a one patient sign up that takes about 5 minutes to do online, collect your comprehensive medical history and center that into your secure profile where that you own and control. So you're able to have, full access to all of your medical data, and use it for the benefits both for you and for the sort of the collective research advancement for your community. So you can choose to share your profile with your care team, or to pull it up in case of emergencies, or to share it with a provider for a second opinion. But now your data is all in one place, much better and under your control. And even more powerfully, you have the option as part of Citizen to provide your consent to have that data de-identified and extracted for use for research purposes. This is really where the power of community engagement comes to play. Imagine being able to unlock the collective insights that are, in the health journeys of all of the I-defined community. It's something that's very powerful and something that we are partnered on together today to continue to grow the impact around. So what this looks like in practice is really quite interesting, and it's something unique that Citizen offers. Is it's not just playing on ICD codes or things that can get from a claims database. We're actually taking the rich, unstructured text that is in the provider or clinical notes that many patients don't even ever get access to, and we're able to actually normalize that data into rich, structured data sets that can be used for research purposes. So what you can see here is just an example of how we take a clinical note and actually use standardized terminologies like SNOMED and RX norm and LOINC to extract standardized concepts that create these structured data sets for a disease area. So then what that looks like in practice is families take a few minutes to sign up. We collect complete and compliant data for patients that are in the US. I'll talk about how we work with international patients shortly. We then transform the raw medical records into rich, usable data with the patient's consent if they decide to participate in research. And then that data can then drive the research initiatives for programs that are looking at the community and how they can support the community and drive forward treatments. In addition, the patient's medical records and the collective wisdom of the community that's extracted through this process can be used to support many of the new tools that we have available and we're in your profiles today, and that we're building for the community moving forward. So as a result of all of this, what we've really been able to do is accelerate research in rare disease in a way that previously would have taken much, much more patient engagement and interaction that's not always accessible to the community. So again, we're very much focused on low patient burden mechanisms for collecting and really shedding a light on the disease in a way that hasn't been able to be done before. So we've published over 11 manuscripts, 25 abstracts across rare disease cohorts, and this list continues to grow. And we've powered regulatory filings with the quality of our data, accelerating drug development timelines by years in some cases, as was the case with our Praxis IND filing for the SCN2A community. I'll talk a little bit about other case studies of our data so you can get a sense of how this data has been used, can be used, and will be used to help forward research across the rare disease community, and potentially even with the Kleefstra syndrome community as well. Maybe first I will talk about what does it look like to join Citizen, especially for those that haven't had experience with the platform to date, and what are some of the benefits as well as the new tools that we offer that we would really love for you to check out and interact with today to give us some feedback and continue to build this with us. So first, in terms of the patient onboarding, I have up here at the top the URL you can use. We can maybe even chat that through to the Zoom right now. If you want to take a picture of the QR code, you can actually go through onboarding probably in the time I finish this slide, to be honest. So you create a username and password, or you can log in using your email address, use that to set up your account. You enter in some basic demographic information, and then you're surfaced two different consents. One is to share contact information back with the I-Define advocacy group leads. And then the other consent is the option to contribute your de-identified information for research purposes. Then you enter in the providers where you or your loved one has received care. This is where we're able to get started on collecting those medical records for you if you're seen in the US. And then a few basic questions to validate your identity, and then we're off and running from there. After you set up your profile, we work to collect the medical records for you, and you'll be updated as those are centralized in your profile on Citizen. This is what your profile looks like once you've created your account. We give you the option to easily and securely share your profile with whomever you choose. Again, if you wanted to share that with your care team or provider for a second opinion, you can toggle your consents here at any time. And this is also where you can access the new personal AI advocate that we've built in collaboration with the rare disease community. So I'm excited to talk about what that tool is, how you can start using it, and some of the things we've seen with it to date and how it's benefited the community. So available now in your profiles is our new AI advocate tool. This is really the ability for you to unlock insights from your own medical history. So it is based off of the data in your medical records. It is a AI advocate designed for the rare disease community by the rare disease community, and you're able to easily query pages and pages of your medical records to help get instant answers about the medical history. This is everything from, can you summarize my child's medical history? I'm going to go see a new provider and I want a nice quick summary. Or what are the most common side effects of this medication? Or give me a list of all the different medications that my child has been on. It's really good at, making that data much more accessible to the caregiver and the patient when they're thinking about their day-to-day care needs or planning their next steps. In the not so distant future, we'll be able to actually chat with the collective de-identified wisdom of the entire community. We're really working to help build community knowledge bases with the rare disease community. So the best, most informative information can get surfaced to patients and caregivers when they need it most. We're starting with this AI advocate, and every patient, everyone and every caregiver that interacts helps us build this stronger for you. We really want to personalize it to each community to help you get the most out of it. So we definitely invite you right now, especially if you have an account and you have records in your profile, please log in, check it out. We'd love to hear your feedback. How have you found it useful? How has it worked well? Where could you see it be improved? We're truly building this with the community, and we'd love to get your feedback. So that's an invitation to please try it out. If you don't yet have an account, please feel free to create an account, and you can start using it as soon as you've created an account. You might not have records in your profile right away, but you can always upload a few of your own records that you have on file just to get started and see how the tool works. So really excited to get your feedback on that. Okay, so the next thing I wanted to do was introduce to you the Kleefstra syndrome community that's on Citizen today. We have some just high level insights from the community members that have onboarded. We're in the process of collecting the medical records for the community and growing the community on Citizen so we can work towards bigger research milestone goals for the community. So just a few things to maybe illustrate who's on the platform today. We have a little bit over 100 patients that are consented on the platform, which is very exciting. You can see the relative age distribution of the patients. Most of our patients tend to be about 6 to 12 years old from this particular community. We have about a 57%, 43% female male split for those that are on the community platform today. And then in terms of the top states represented in the US, we have the most from California, and then a nice distribution across, Florida, Illinois, LA, Maryland, Texas, and so on and so forth. So again, this is just a high level snapshot of the community data for those that are in the US. I didn't want to forget the international patient community. I wanted to make sure that we spend some time talking about, if you're an international patient, how you can get involved and engage and support this community effort. The international patient experience is a little bit different than the US patient experience, but we're continuing to advance the offering for international patients. Our onboarding and process is translated into 7 different languages. We do not collect the medical records on the behalf of international patients at this time, just due to different regulatory environments in different countries. But you are able to upload your own medical records. So if you're an international patient and you want to join Citizen, you're able to make an account. You can upload your own medical records and then use the platform from there as you wish to have all your records in one place. You can share that with whomever you choose. Then you could, especially if your records are in English or Western European language, the AI advocate works pretty well with Western European languages. We are looking for more international patients who would like to help us test the AI advocate in foreign languages. So please, reach out to Eric or Jeff if you're interested in being a beta tester in the international arena for our AI advocate. And then international patients have some options to participate in research as well. For example, we're able to extract and de-identify information from the genetic reports to contribute that to research efforts. And then, of course, you would be able to sign up and participate in the iDefine registry as part of being on Citizen as well. Okay, wonderful. So in terms of next steps, really what we're hoping to do here is get to 150 total community members on Citizen as part of the iDefine community. This is to help strengthen the research and insights that we'd be able to glean with the data from additional folks joining. So there are about 25 families that were in the process of signing up that didn't quite finish. So between those 25 patients and families taking a few minutes to finish up their profiles to 25 new families joining, we would be at this milestone in no time. So I know we could do it. So feel free to take a few minutes and sign up using the QR code or the URL here. And then maybe just also to give you some insights into, as we start to meet these community milestones, what are the kinds of things that we might be able to do with this data? There's a wide variety of both research questions and community support questions that we can gain a lot of insight to with the longitudinal natural history data and even subsets of the data we're able to extract on Citizen. So to that end, I'll show you a few things, which is really, all of this data goes to supporting patients and supporting research. So whether that is to help a newly diagnosed family understand what's next to what is the standard of care in the community. This kind of data, again, helps shed a light for the community on how to characterize the disease in really important ways and in a way that's collected without patient burden because it's completely digital and online. And so this is an example of an analysis we were able to do with the FOXG1 community data. What you see here is the most common symptoms on the y-axis. So you can see, developmental delay, gastral reflux, hypotonia, and then you see the median age of symptom onset. So what does this tell us? Well, this really paints a picture for how the disease progresses over time. And for a family, especially one that has, a child that was recently diagnosed and is altogether new to this is really important information of like, what could potentially the future of this disease look like for my child? How do I plan for my future? Something that comes up oftentimes when we talk about this data is its impact in helping families plan even financially for their future. Like, what should they expect 10 years from now based on how these conditions and symptoms progress? And of course, no one child's patient's journey is the same. We know there's always differences, but getting more data and more information into the overall community analysis will help us strengthen what are the different pathways that this disorder can take. An example that I like to call out here, which is Nasha. We talked about her at the beginning and her daughter, Amara. When Amara was first diagnosed, they went to their epileptologist and they were talking about, at what age would Amara be able to walk? And, it was a leading clinician at the time said, oh no, FOXG1 kids don't develop the ability to walk. And in fact, Amara did end up walking, and they found that much of the FOXG1 community does does eventually get to those developmental milestones. And it just was at the time, there wasn't enough data to know that about the community. So parents are making the decision, should I invest in a wheelchair? Should I invest in physical therapy? These are the types of things that this kind of data can help us wrap our heads around, or at least have a better playbook for how things progress, even though, of course, every patient's journey is unique. Something else that I think is really important to see at the community level, is around how do we think about standard of care for the patient community. So you don't need to understand what this graph exactly says. All you need to know and see is that it is quite complex and there are many different pathways here. What it is showing is basically unique medication combinations per patient. So for example, if every patient had the same sort of same journey in terms of the types of medications they were taking as part of their symptom management, and this would be one line across the way. But what you can see is almost every patient has a diversion in different medications that they are trying. The FOXG1 community actually used this to really start to advocate for themselves and for their communities and bring this to the clinicians to say we really need to drive better standardization in our disease management, because right now there's no consensus around the best pathways to take. So this again wasn't the answer, but it helps shed a light on where we can focus and the fact that this is a problem in the community that is definitely worth prioritizing and that the community really cared about. Another application of the data is to see maybe the effectiveness of certain medications on symptoms. Again, this is on the FOXG1 community just to keep consistent. We were tracking here the effect of medications on the number of seizures per day in one patient. So at the top here, you see a patient and the number of seizures they're having over time, and you see the different medications as they start to try the medication and sometimes even stop the medication. So you can see this particular patient presents emergently with, over 50 seizures a day in their first year of life. And you can see that immediately they start trying different medications to see if they can bring that number down. So you can see how it does start to decrease with the use of medications and so on and so forth, but it's not until they have the VNS at the bottom here that you see really persistent relief of those symptoms. So I know seizures might not be applicable to most of the community here, but it's just one example of how we can use data to start to tell the story of treatment management, of treatment effectiveness, of patient journeys, and things that, again, help shed a light on how we're managing this condition and what are the best practices in order to do so. The last example that I will leave you with is that one of the most important things that a community does as part of their regulatory filings and presenting this data to the FDA is demonstrating the burden of the disease on families, on patients, on the overall ecosystem. And through the citizen data, this is something that can very powerfully come out of the citizen data. So this is for a snapshot of the SCN2A community, and this is sort of like what we're showing here is the average number of medications, of procedures, of hospitalizations, and hospital days in the first year of life for an SCN2A patient. So this clearly demonstrates, almost 70 hospitalization duration days in the first year of life for a patient, clearly demonstrating the burden of the disease on the family, on the system. And this is what was one of the graphs that was submitted as part of the IND filing for the ASO that I talked about earlier for the Praxis Precision Medicines. So again, it's with data that we can better tell the story, that we can better unlock insights, both for community care, but also for research. So again, I'll leave you with encouragement that I know we can reach this goal very quickly, and every community interaction, every sign up goes to help building this important knowledge base. So I will pause there and say thank you so much for your time, and I look forward to any questions that I can help answer.
Thanks, Kate. Yeah, really, really cool examples, and just it is amazing. The mind just kind of boggles when you start thinking through all the questions you could ask of the data once it's all there. I feel like we're just scratching the surface of the kind of things we could ask about. I had a question in terms of how the system works for the user. So once they have consented to get their records pulled, how often will the system auto pull to keep re-pulling their records and keeping that up to date, or do they have to sort of push a button and make it happen?
Yeah, so to date, the users have had to push a button and make it happen, but we are in the process of implementing about an every 6-month auto refresh where we know the patient has been seen. So that will help keep records up to date without, again, you having to lift a finger. But we do encourage patients for the time being to go in there, and especially if you've seen a new provider potentially since you've last signed up, that's always helpful information to let us know to make sure we can grab those records for you.
Okay, great. So basically, the suggestion for now would be if you know you've had a lot of recent visits, it would be a good time to basically go in and push that button and say, be a good time to repull my records so that you get the latest information.
Yeah, exactly.
Okay,
And because we haven't implemented the refresh mechanism yet, I would expect that we would do that early next year. While patients are in there, please go ahead and request your refresh just to get us through to the end of the year, and we'll have the latest data for you.
cool. And I had another question, which is, I think there's a lot of challenges with, we were talking about in previous discussions, the survey fatigue of like having to, fill out surveys, and it's really important
Yeah.
for platforms that use that. But I think with you guys, it's basically the survey fatigue is zero because basically you're just pulling data and all that data is coming in without having to really lift a finger, which is a really nice um, aspect of it for the end user. That there is a pretty once they get through their registration, it's a pretty low amount of work.
That's exactly right. And really there's so much we can answer through the medical record that we shouldn't have to ask patients and caregivers questions over and over again that can already be answered by the information in the medical record. So that's where you can get even more specific and targeted if you need to use surveys that are sort of above and beyond. You're just asking about information that we can already grab from the medical record. So it's going to be a very much more consolidated set of questions, maybe much more community motivated that the patients and caregivers want to hear about that otherwise, aren't unlocked by their records. So again, it's very low low patient burden.
Well, and yeah, I just plug for the AI advocate because I was one of the beta testers, and even when it was a beta, it was really cool and really useful. And so I can't wait to really start using it out in day-to-day interactions with medical professionals and so on. Question about that because you were showing how you can query, your family members' records, and it's obviously those records are stored securely, and you're getting data from those records in your. But it sounds like you guys are also able to at the same time you're pulling data from the secure records about this patient, you can also get information, background information, because you were showing queries like, we're trying to get this level of service and what can we use from our medical records? And then it was pulling together the two sets of, is that what's actually happening? That it's actually able to be a general bot and query public information, but then also integrate that with the private information of the medical record.
Yeah, that's the beauty of this, which is what we're actually doing, and we're working closely, Eric, Jeff, with the PAC communities too, which is the patient, of course, can query their own medical history, but we have like a curated list of high quality external data inputs, i.e., publications, high quality online resources, and we'll be working with the PAC community to build your knowledge base, like your validated knowledge base of what you believe to be the best practice in terms of the research and publications out there that should feed the AI advocate. But we have a preliminary set of, of approved, PubMed, those types of research engines to help fuel the answers to the community. Exactly.
Fantastic. Okay. And I think just to reiterate, the AI advocate is now available to all users. It's out of beta and you can start using it without special permissions.
You can start using it without special permissions, but with the ask that please give us your feedback. We're
Yes,
continuing to build and improve on this every day. And again, we can't emphasize enough that we envision an AI advocate personalized to not just the rare disease community, not just to the I-define community, but to the patient. So the more interaction we get from you, the more feedback we get from you, the stronger, better we can make this.
And Kate, could you go back to the slide that broke down the age range of the folks on the platform?
Yeah, sure.
Because I want to double click on this for a couple reasons. Eric and I attended the Combined Brain Conference last week, and we were asked to be part of a presentation with GeneDx, and it was
Yeah,
interesting to see the breakdown of our age range from GeneDx of the age of genetic testing and diagnosis. And what's interesting, it was basically inverted of what this graphic is
interesting.
yeah, that it actually skewed to an older population. And what's interesting with this AI advocate is those are the folks who are going to have record upon record upon record piled up, right? And so that's where this AI advocate tool becomes incredibly useful, is because there's a library of information literally to
yeah,
sift through. And so now, I think a lot of the rare disease space slants pediatric, I think that's the nature of it, right? And so if I'm sitting in the chair of someone who has a child afflicted that's 20 plus years old, where are the opportunities for me to extract value from the efforts that we're putting in beyond just a legacy, a contribution to the community? There's a bunch of things that they can add value to, but on a personal level, how can we add value to their experience? And I think this is where there's an incredible opportunity for folks who have a child that is aging up, and now you have so much medical history that will be literally at your fingertips on the app with the AI advocate. Like that seems like a really powerful tool. And so I just like when I was just thinking about the GeneDx presentation last week and seeing that graphic, there's a huge opportunity for us to like the 50 number we should blow by, frankly, right? And so I just want to I would almost plead and ask the folks who have a child that is above the 12 age range, really look at this, because I do think it's going to add immense value to your patient caregiver experience.
And just to echo that, Jeff, especially those that have a longer medical history with this condition, to your point, one sign up, there's unlocks even more knowledge based for the community. So when we talk about things like the natural history study, getting more of those older patient population can really help make that more robust and help us paint the picture even further out. And then as we get into being able to unlock insights across the entire community, when we talk about evolving the AI advocate to be able to query the de-identified insights of the collective community, again, year one sign up for a child over the age of 12 can be, can really make the difference in terms of adding to that knowledge base in a very meaningful way.
And
Yeah,
Kate, you
and
said
we
to go ahead, Jeff.
go ahead. Well, I was going to say we've seen that throughout the day with Anna's presentation, with going back to this morning with Yost's presentation about regression in the natural history study and what the data and the graphs are showing there. As we age on with this condition, there's so much information to be able to extract from that that can really help paint this 360 picture.
And Kate, as people use the AI advocate, you said provide feedback. Is there a mechanism built into the site to provide that feedback when they're using it?
Yep, there's a little chat feature when they're on their
Okay,
when they're on their profile, they can reach out directly to us.
perfect. Okay, yeah, great. Yeah, I think it's
And
just really it's such a win-win, because it's you're doing something great for the long term for the community, but you're getting an immediate benefit of the ability to query your own records. Yeah, so it's very much like using ChatGPT, and I asked it to just write a medical summary in like 5 paragraphs of like my son's medical history, and it did a pretty good job of just like kind of just giving all the highlights, right? Which is like the kind of thing that ChatGPT can do, and it's pretty
Yeah,
handy.
that's
Yeah,
exactly right. And we know, like, I'm a patient myself, and I've used ChatGPT before for things exactly like that. And we know patients are doing that, but we also know that ChatGPT isn't building AI that is, fitted for the rare disease community. So
yeah,
that is what we are building and supporting and training on, is making sure it can best support the rare disease community questions and high quality
yeah.
answers.
Yeah, and of
So
course it can't
and
have access to private data, right? So you guys
exactly,
have this
yeah,
data that's in a secure location where only you are going to see the queries against your own records, and that just changes
precisely.
everything, right?
Mhm.
So we have a question which that this unfortunately their child is 39, and Citizen has told them that a lot of the facilities have purged some of the records and they would need to scan in their personal copies. I don't know if you have any comment on
Yeah,
how
it's
often that's you
unfortunate.
guys are running into that, Kate.
It can happen sometimes at certain facilities, if after 10 or 15 years, some facilities unfortunately might not hold on to the records, which
It's a
unfortunately we
shame.
we don't have control of. It is such a shame, and we
Yeah.
really do our best to get as far back as possible, and we have some success. So it depends on the institution. So thank you for raising that question. If you do still happen to have some of those earlier records, which I know is a lot to keep track of, feel free to upload those, but that might be a case for older patients in some facilities.
Okay. And if they do scan them themselves, though, they can upload them directly
Exactly.
as
They can
scanned
upload them
files,
directly.
and then you
Hmm.
guys would scrape from that to get the database. Okay.
Precisely.
Yeah. Okay.
And I think I would just end with closing. I would also just there's monthly meetings that the PAG groups have with Citizen. Citizen does a great job with sharing information, developments, things on the horizon, and they're not resting with this. Like I think this is an incredible value add, but there's a lot more to come. And I think I think it's public knowledge that they've recently raised a Series A. Kate, that's something I could speak to, right? So
Yeah,
they
absolutely. Mhm.
okay, so they went out and secured $30 million in funding, and so with in this space, you know, you're constantly having to evolve and move forward. And I think from what my seat and the things that I'm hearing about what's going on with inside the organization is they're very forward thinking. So this AI advocate's been in development for some time, right? And so they already have, you know, phase 2, 3, 4 that they're getting lined up to roll out to communities too. So again, I think it's incredibly important, Kate, that you have a personal connection in with the rare disease community. Obviously, Nasha, for those who don't know, is the leader along with another mother of Fox G1, and they've done some incredible work in the space. And so we have a lot of trust in that their interests are aligned with ours, and also have the unique perspective of being in the same position as us. And so you know, data can be scary for people sometimes and how we share, but when folks are in the same or riding the same bus with you, I think it should give everybody some confidence that not only are we realizing some successes now, but there's going to be more to come in the future.
100%. We are building tools and resources because we want them for ourselves and our children who have rare diseases, and alongside and in partnership with the rare disease communities. So we have to change this together. We're going to build this together, and we're excited to share with you what's coming up.